Well, hi, Jared. Welcome to our Tips in 10 Minutes. It's so nice to have you.
Thanks, Kirsten.
Yeah, well, I think it might be best if maybe you introduce yourself. I think everyone knows you, but you have your hands in so many different things. So I would love to hear how you describe what you do in our industry as you're kind of a pro and a celebrity among all of us.
Well, yeah, thanks. Thanks. You bet. So I think the short version is 20 years in marketing. Most of that's been in healthcare. The last 6 years, my focus has been on helping build and design consumer experiences and just understand what it means to innovate around their needs. And then I'm the host of the Healthcare Wrap along with my co-host, Saint Ismail. It's been going strong. It's the leading podcast about consumer innovation. So similar topic there, but yeah, we've been on the air for 6 years, 300 plus episodes, and we just have a lot of fun there.
Yeah, no, I love following along, and I've attended a few of your Friday consumer phone calls or big, large meetings of community that you've gathered. And you forgot to mention that you're also an author. You've written a couple of books, so tell us about those.
Yes, yes, thank you. Yeah, well, and it's ironic because both books have been compilations of podcast episodes. And so
Okay.
the first one was called Connect the Docs, and it was a handbook for clinicians to help them kind of wrap their mind around digital health in the early days of digital health. And so understanding what it means to empower patients and to use digital health tools. And then the most recent one was called Marketing Forward. And that was a vision for marketers to understand that they can play a leading role in driving consumer transformation in healthcare, what that means. And so it was a compilation of 100 different monologues that we do. There's like a little new that we do each
Mhm.
episode, which is just a quick little like 2 to 3 minute thought on what's the latest thing that Amazon's doing, or somebody else has done, and what does it mean for us in the industry, but also consumers that we're serving. So yeah, that was the most recent one, and both have been a lot of fun to put together.
Yeah, so what's next? Do you have another book, another podcast? You'll be chairing
No,
a conference here in a few weeks, so we'll talk a little bit about that. So you're keeping yourself busy. So we
I
appreciate
am.
you spending 10 minutes with us. So thank you so much.
You
So
bet.
we're gonna have a little bit of fun. We're gonna start our conversation today. We are obviously here at WriterGirl. We love our words. And maybe you've done this before, but I know my friends and family, we love to do this every year. And it's like you see those puzzles where it's a bunch of letters and you kind of look at it and you're supposed to pick your words, and those words become your mantra
Yes.
of the year. So Jared and I have one of those in front of us, and we haven't looked at them yet, so we're not going to cheat. But if we want to just take a quick look, write it down. Don't say it out loud yet, but write it down on a
Okay.
piece of paper. What three words you see? I'll do the same, and then we will share our mantra for 2024. And we'll just spend just a few seconds here.
All right. Sounds fun.
Okay, here we go. Write mine down.
Let's see. Okay.
Okay, you have yours?
All right. I
All
do.
right. All right, what jumped out at you?
Okay. The first one was abundance,
Oh, I like that one.
and then gratitude and purpose were the three that caught my eye.
Those are really good ones. I like those ones. Abundance, especially. Everyone can go into a new year with a mantra of abundance. My three words were alignment, gratitude,
Mhm.
and love. So those were the three words that jumped out for me. So I think those were pretty good too. So
Love it.
those are our mantras for 2024. So we can do what we want with those. So in the spirit of using words, and certainly with your experience in the space of healthcare consumerism, what three words would you use to describe the healthcare consumer in 2024?
Oh my goodness. That is a challenge. This is what I should have expected. A word challenge. So,
Yes.
okay, so yeah, narrowing down to a few words. I think I would describe the healthcare consumer as, I guess the came was they expect more,
They expect
and
more. So you're using it really
they
more as a
expect more.
sentence as opposed to three separate words. I like it.
Fact of just kind of where it seems like
Yeah.
we are with the state of consumer transformation and the understanding of what's not only possible, but what's beneficial to a provider or a healthcare system as you become more consumer centered. Because in the early days of consumerism, when we first started talking about it, I don't know how many years ago, many years ago, way before the pandemic, we just talked about it as like this is a thing. People have choices, and so you
Mhm.
you you might need to be nicer to them. Like you might need to guide them a little bit more and explain to them how complex it is,
Mhm.
their encounter with the healthcare system. So as long as you explain to them the complexity, you're going to help them make their choices. And granted, not all aspects of that apply in all aspects of healthcare. We don't have choices all the way across the board. It's not like a one size fits all, but it was the awakening of, oh, we do need to have certain information on the website about providers that we haven't had before. We need patient reviews. We need some interests and some things to help us understand how to select a provider. There's more than just you're being told to go see such and such specialist and you book with them. So I think that was a good foundation. That's kind of consumerism 1.0, right? And that's
Mhm.
kind of what's been fueling a lot of updates to digital properties, digital marketing
Mhm.
strategies, and for the last, I don't know, let's say 10 years, especially the last 5 to 7. And where we're going now, I feel like is expectations, and that does bring on a different level of priority for understanding some areas that we can reduce friction in the experience. So that's on the digital side, but it's more than just explaining that it's complex to people. It's actually making things simpler for them so you don't have to explain as much. And
Right.
that hopefully makes it more likely that you're going to at least meet some of the expectation of what it's like to encounter
Mhm.
someone in healthcare.
Do you think, I mean, when you say they expect more, do you feel like healthcare today is meeting their current expectations? So now it's more about like, well, now it's they expect more. Now it's like, let's, exceed my expectations. Do you feel like we're doing a good job meeting those expectations? Or, I mean, I think I just heard you say like, maybe not, there's still opportunity there.
There's definitely opportunity there. I mean, there are, well, there are thousands, what, 4,500 hospitals, something like that in the US. And
Mhm.
so there are, seems like a little more, a little less, somewhere in that neighborhood though. So there's a spectrum of how we're responding to that and how we're able to prioritize that. First and foremost, I want to convey that the empathy that anyone in this field has for one another of trying to
Mhm.
address this opportunity together. And part of that is maybe it's some of those more surface
Mhm.
based needs and expectations that we have that are being addressed a lot better than they were a few years ago. We do have more information to help us select a provider.
Right, right.
A lot of hospitals and health systems do have online scheduling tools.
Mhm.
They do have some the same as we experience in other areas of our lives. And I used to
Mhm.
just be like, well, why even try to do that? Why
Right.
bother trying to make something more like that? Then we encounter anytime you order something off Amazon or you see what Netflix recommends to you next or whatever, like any streaming service, you realize there's a lot
Right.
happening below the surface that is helping personalize something and has made an
Right.
experience easier for you. You don't have to do everything yourself. And so I think those are some of the areas that we do have opportunities to build and design a whole nother level or type of experience that isn't necessarily common right now.
Right. Yeah. Yeah. Well, I mean, I think consumers just generally are becoming savvier. I mean, as the way we access things is becoming easier. And so our expectations are constantly changing. And so we expect that from everyone, everywhere. I think so it's an opportunity, not just for healthcare, but for every business for sure. So with that in mind, I mean, that they expect more, those being your three words, um, what can healthcare communicators do today? Maybe what can they start doing, stop doing, keep doing? What sort of tips would you give them to better meet today's healthcare consumer?
Well, first and foremost, I would just say acknowledge that health journeys are different for everybody.
Mhm.
And even when you do journey mapping, I feel like journey mapping is making a little bit of a comeback. It didn't go away anywhere, but they're in high demand right now uh, for uh, for healthcare organizations
Mhm.
to understand. And I do think that's attributable, at least partially, to the recognition that there's not one size fits all. We've known that, but even to an nth degree of so just thinking about brand experience as part of your marketing strategy helps connect some of those dots, right? We all know that brand dissonance occurs when there's that brand experience doesn't match the marketing promise.
Mhm.
If all of the campaigns are saying something that we're making things easier for you and your experience doesn't match that, there's some dissonance that occurs. And so
Mhm.
sometimes that renders those marketing promises more aspirational than actually functional. is not
Mhm.
actually what people are experiencing. There's nothing wrong with the marketing promise that says we're making, we're bringing high quality to you in a simpler way. There's all sorts of iterations of that in
Mhm.
dozens of hospital and health system campaigns. It's great. It's recognizing that there's a difference and maybe a gap between that and what people experience. And so that has to do with just simply listening to people who
Mhm.
are encountering your health system. Then I would also say to open up your competitive analysis. A lot of times I don't know, when I was hospital side, client side, we weren't looking at non-traditional providers of care within our competitive grid that we were doing. Like, what
Right.
are they saying? And the fact is, some sort of those traditional as disruptors, sometimes not all the time. I recognize that can come across as a little disrespectful sometimes to the great work that our clinicians do in
Mhm.
traditional provider organizations. But the fact is, there are a lot of those digital and retail health offerings that are marketing themselves in a very aggressive way that we might not realize if we're not actively going out and seeing it. And it's very clear, it's clear as day on any of their websites, but it's wise to include that in your competitive analysis. So
Right.
you're talking about consumer brands anywhere from Amazon to Costco to Walmart to CrossFit, CVS,
Mhm.
GNC, Hy-Vee, Albertsons, Walgreens, Oak Street, ChenMed, Firefly. Like, it can come from their employer, but they're all, if you look at any of those sites, they are saying, finally, come see a doctor who cares about you enough to make it easy for you to schedule with them. Like, the messaging themselves, as soon as you start seeing that, it's wise to include that in your competitive grid, because that is some of the marketing that's being sent to your target patients as well.
Mhm. Right.
And then I'd, then I'd finally just say, just to prioritize the investments that are going to be necessary to meet and exceed those expectations. That's the long-term piece. That's going to take some time to even understand what those investments are, how they're
Yeah.
different than what you have now. But yeah, it's going to take some investing there, and prioritizing that now is worth starting to look at.
Yeah. So really being empathetic, so understanding, listening, and taking, the different journeys of your consumers and your market, understanding the competitive landscape is certainly important, and who's in that pool now is very different than who was a few years ago. And then really just prioritizing, right? Of prioritizing strategies, investments, and budgets to meet those kind of accelerating changes and needs um, seem to make sense. And I think that topic, which is a nice segue to our upcoming conference that you're chairing, the Marketing Summit, Healthcare Marketing 360 Summit. We have a launch year for that, right? So this is our first year, and you'll be speaking and you're chairing the conference, and you've got a couple of topics there on consumerism and even addressing the disruptors in the marketplace and really leaning into brand loyalty. So that conference is still open for registration. I think it's in Nashville. I know it's in Nashville. It's March, 16 through 19. So we'll be sure to include a link for people that if they want to register and attend. I think it will be very informative and a lot of fun. And anything you'd like to add about the conference?
Well, first and foremost, I am excited about it. It is the first year, so it's going to be a lot of fun. The main conference occurs the March 18th through 19th, and
Okay.
there's a meetup and things starting on the 17th. Uh, I can throw the discount code out there. I've got a
Yes.
25% discount code out there. It's just
Yeah.
Jared 25. I
Yes.
did not create it. But it's all caps JARED 25. It's good for 25% off registration. We'd love to see
Yeah.
even more people come there. And yeah, one of the sessions I'm doing is kind of related to one of the topics I shared. It's called Market Like a Disruptor. And so
Yeah.
it's about just even recognizing how these non-traditional players are shaking up the industry, and their marketing messaging is at a very different level. And understanding that, I think, will help health systems understand even just how to, on the front lines, communicate with patients that they do care about them in a different way, rather than just have everyone who's out, a new competitor do it for. So I think we'll have
Yeah.
fun in that session, and yeah, I'm really looking forward to it.
Yeah. So appreciate again you spending 10 minutes with me today for our tips in 10 minutes. And we'll include links to all the information, maybe even to your book as well. So, or one of your, both of your books, so everyone can follow up and purchase that if needed as well. So thanks again.
So much fun, Kirsten. Hope you have a great time. Really appreciate being invited.
Yeah, you bet.